I'm Jamie Burgess, Senior Vice President of Marketing at Qventus. We're here sitting down with clinicians, surgeons, hospital executives, and technologists talking all things AI. I'm here with Dr. David Atashroo, Chief Medical Officer at Qventus. Dr. Atashroo, thank you for being here.
It's a pleasure to be here, Jamie.
So tell me about our AI operational assistants.
Yeah, so our AI operational assistants is a new platform that we've launched to be able to offload a lot of the burden from frontline teams. There's so many things in healthcare today that we as clinicians want to do, wish we could do for our patients if we had world enough and time enough and staff enough to do that. But the reality is we don't, and therefore a lot of really critical tasks go missed, or many of them are done suboptimally. And that is a real detriment to our patients. It's something that weighs on my mind, and I know it makes it feel like we are missing out on helping our patients to the full extent that we could. Our AI operational assistants are now a platform that comes alongside the team and the staff that we've hired to help our patients to be able to offload a lot of those really critical administrative tasks, but the things that are far below the top of their license so that they can do 5, 10x more of what they were needed to do beforehand. And I think that's pretty exciting for our staff, both for me to feel like I can bring them something that brings some joy back in their life and allows them to do the things that they were actually trained to do and return to the bedside, but at the same time allowing me to have the confidence to know we're actually able to help all the patients that we're supposed to.
We're sort of providing a personal admin for all of our frontline healthcare staff in a way.
That's right.
Talk to me a little bit about the practical applications of the AI assistance as it relates to perioperative care.
Yeah, it's such a good question. There are so many things today, practically, that we need to do surrounding clinical care just to make things happen. A patient just can't come to have surgery. We have to make sure they're optimized and ready for surgery. That means they need to know where to go, what medications to stop, what medications to start, what time to show up for surgery. They need to have their nutrition optimized and their weight optimized and know if they're smoking to stop smoking. And all these things have a direct impact on the surgery. And if they're not done, they might not be able to have surgery. We may have to cancel. And if they do have surgery, they may not get an optimal outcome. And so practical tasks are, that requires a lot of phone calls and emails and texting and coordination with patients. Things that now these operational assistants can do, because they can actually do them for my staff and my team. They can go collect the outside records that are required. They can identify where there's opportunities to optimize the patient and connect him with the right person within the system to get their health better in order before our surgery. And so I think there's many of these small tasks that any one of them, if not done well, can lead to a negative outcome for the patients. And now these operational assistants have our backs, pulling all those things together.
And I know that patient optimization is a passion area of yours, just in our previous conversations.
Sure. Yes.
Talk to me about, surgery is a big life event, right?
Yeah.
So how can our AI operational assistants help make sure patients are ready and achieve optimal outcomes?
Yeah, so in the patient activation realm, consider that for me and for all my colleagues across every single service line, there are thousands of patients that need to be managed through their patient journey. And that patient journey has a break point every step of the way that, if not done, we don't actually realize the value of quality care being delivered to the patient. And that can go anywhere from patients who have disease that aren't identified, patients that have disease who are identified but they're on the wrong clinical path, patients who they get on the right clinical path but they lose motivation and they fall off that path, or they're educated about something, a condition that should be worked up, like let's say a pulmonary nodule, but they're not activated. They don't know how serious it is and why they should actually go for a screening colonoscopy, why they should go for a bronchoscopy to work up that pulmonary nodule. And all those things require the patient to be identified and coordinated with and educated and activated. And then through the process, they have questions, they have concerns, they need those things answered. They need to go through and get nutrition consult ahead of time, or a bronchoscopy ahead of time, or they need to go see a psychologist and have an evaluation. And who's managing all those things to keep them going through that process? No one to do that anymore. Now that we have these operational assistants, I think it's a breath of fresh air for me and my colleagues who know that there are so many more people that we could help and we could treat, that now we have the capacity to do that. And the ones that we actually see in our office are actually going to make it through the process all the way to a surgery that they need.
We hear from our hospital and health system clients that surgical growth, strategic surgical growth, is a top 5 priority across the board. We also know, and I hear you talk a lot about growth for growth's sake isn't valuable. Talk to me a little bit about that conundrum.
I think it's such an important point. You can grow, but that doesn't actually necessarily help you or your patients. So for instance, you can grow, and at the same time, your growth is actually hindering access to patients who have more critical need, and now they have to wait longer. That's not what we want to do. You can grow, but you could actually be putting cases in a place where it makes it harder for patients who have a more critical need to get access to surgery. If you're not actually driving a site of service or care realignment strategy, you may actually be negatively affecting your overall patient health and patient care. You may be growing, but putting cases in places where they don't exist, causing delays for staff and everyone else in the operating room that day. So you're creating more inefficiency as you grow. Those are things that don't have to be true. But if you're not programmatic in the way that you're actually growing, those things will be true. And so I think there's this really unique opportunity that if you're to reframe how we think about what's important. What's important is not OR utilization. What's important is not just growth for growth's sake or growth at any cost. What's important is to grow, but to grow thoughtfully, in line with what your community needs, in line with what your patients need, and in line with what's strategically important for your hospital to enable your mission, to develop the margin that you need to stay afloat. Those are all the things that you should be taking into account as you grow.
So let's build on that theme of growth. How does Qventus's perioperative solutions and our really unique market insights help surgeons grow their practices, hospitals strategically grow, et cetera?
That's a great question. So the first thing is, if you're going to grow, you need to actually understand what is the market opportunity around me. So get a kind of a weather pattern of where have I come from, where do I currently sit, and where do I want to go? And some of that you can get from a deep understanding of your actual data inside your EMR. Some of that you actually need to understand through claims data, what's going on in the market around you. And so that's first where you got to start and understand, okay, where do I have network integrity issues? Where do I have surgeons that I may not be able to offer the right time to them, and so they're splitting cases and going elsewhere? Where do I have situations where I'm not putting patients in the right place, and therefore they're choosing to go maybe somewhere else where they can get care in a better care setting, like in an ASC? So you got to first understand where you're at. And Qventus helps you do that because we have all the data and the tooling to enable you to understand that where you kind of stand in the market. But the second thing is then, how do you actually make that actionable? So you need to actually be able to be programmatically take that strategy and connect it into operations. And that's what Qventus does for you. It allows you to then set a strategy and dial it in and promote it. So that could be any number of things that you might set as important to you. It could be a service line that is a destination for center for you that you need to promote. It could be a critical need in your community. If you see oncology patients are waiting too long to get into surgery, we should prioritize access for them to help them get in. It could be a margin that's really important for your hospital to stay afloat, and you need to target a certain type of specialty. All those things Qventus allows you to actually have control to do. So that is in many ways flipping the scripts. It's not just saying we have this access, we've optimized supply, now it's a field of dreams. We hope the right things come. I think having a hope strategy in healthcare it's ill-informed, but it's also not fair to our patients. We have a bigger duty to say that if we can actually control the way that we grow so that we serve our communities better, that's what we should do. And Qventus gives you the tooling to actually do that.
A lot of our clients operate in highly competitive environments. Surgeons, sometimes do have the opportunity to take their cases elsewhere.
Yeah.
How do our market insights help our clients remain competitive so we can bring that care and access to patients?
Yeah. If you only see part of the picture, you're never actually able to take an action that is informed to what's going on in the market. I think one thing is we give you the complete data so you can understand what's going on in the market around you, but also understand what's specifically actionable. Who's referring to me today that maybe is only referring me part of what they might be able to refer, and I might be able to consolidate that opportunity. More importantly, I as a surgeon often think about who is getting suboptimal care in the market today because the referring providers in the community just don't know. who are referring providers in the community referring to surgeons that are still doing open surgery, that do surgery at a high enough volume or at a high enough center to ensure good quality outcomes? And can I use the Qventus market data and the automated referral that we have, marketing campaigns that we have, to be able to educate those referrers and activate them to actually bring in the referrers to me for the things that I'm actually best in class at doing? And that's what Qventus allows you to do. It's to consolidate market share to actual expertise in the market for the benefit of patients, so that we can say in any given market, the patients can get access to the best therapies on the best equipment done by the providers who are actually best at doing them.
You know, many of our clients have invested in robotics, programs, yet the utilization isn't there.
Yeah.
How can Qventus help really amplify our clients' robotics programs?
Yeah, and that's a really good question, Jamie. I think it actually comes down to a supply issue and a demand issue. On the supply side, the reality is that as we look across our partners, 20 to 40% of time on those really critical assets are being used inappropriately for the wrong types of cases. What I mean by that is surgeons themselves are putting non-robotic cases in robot rooms, and that creates an access constraint and a conflict for these robotic assets in many of our programs. What Qventus can do is actually, we have bespoke technology that can identify when those opportunities exist and programmatically move out those non-robotic cases and backfill them with robotic cases, while doing it in such a way that doesn't create delays for those surgeons. I think that creates a win-win and takes an asset that you have and allows you to use it more appropriately and drive up asset utilization. That's on the supply side. On the demand side, what Qventus is able to do is actually identify where you have opportunities to bring in more robotics volume. Where are there surgeons that may have been dabbling on the robot, but they haven't had access to be able to become performant on it? We know that surgeons, it's really important for them to get through their learning curve so they can be really proficient, have higher quality outcomes using that asset. We want to help them do that. We want to make sure that we can promote access to them to get them proficient. We also know that in any given community, a lot of patients don't know that they have an option to be seen by a surgeon that can do surgery in a best-in-class way. And let me just be really clear. It's not about the robot. It's about the fact that the evidence and the literature has supported that robotic surgery can offer a differentiated quality outcome for patients, a reduced length of stay, a reduced pain, a reduced complication. And for those indications, and there are many for which it's very clear, we want to promote the best-in-class patient care by making sure the referring community knows how to get their patients to the surgeons who are very proficient in those systems, who then have access to use the tooling to drive up really quality outcomes. And Qventus does all parts of that: education and access and getting and making sure those surgeons have access to the tooling in robotic surgery to do that. I think one of the things that Qventus does uniquely is that we are actually partnered with Intuitive Surgical, and one of the things we recognized was that the best way we could help our hospital partners was by partnering with industry as well, so that we could understand what their strategy was and work with our hospital, our vendor partners in Da Vinci to be able to promote those strategic priorities of the health system. We can only go so far doing that alone. By bringing in Intuitive Surgical and their team and their best practices, we're able to further extend the mission of the hospital and their ambitions for how to grow their robotics programs.
Great. Well, the technology is very exciting. The results that Qventus is driving are overwhelmingly positive. And yeah, your passion for patients is inspiring. So thank you.
Thank you so much, Jamie.